Margie here. Chinese medicine offers so much when it comes to our bones, but many of us are just not aware of the practices. Well, the good news is we can combine the best of Chinese medicine and Western medicine for optimal bone health. And that's what we're going to talk about today. And I'm really excited about our special guest, Dr. Shiroko Sokitch. And Dr. Sokitch is an MD who brings hope and healing to difficult health conditions by blending Chinese and Western medicine with a deep spiritual and emotional healing approach. She has been the owner of Heart to Heart Medical Center in Santa Rosa, California since 1993. Dr. Shiroko is an expert at using many modalities to bring your body to balance and wholeness. Her specialty is healing when it seems impossible. Trained in general surgery and working as an emergency room doctor for 10 years while attending acupuncture school, this gave Dr. Shiroko a broad range of medical experience. Her book, Healing When It Seems Impossible, 7 Keys to Defy Odds, and really talks about her unique and comprehensive healing approach. And in today's talk, we're going to delve into practices that we can put into our life to merge the best of Chinese and Western medicine. This talk is full of all sorts of great information and little nuggets that we can use, so stay tuned. Welcome, Dr. Shiroko. I can't tell you how happy I am to be here with you. And I'm so excited about what we're going to talk about today, because this is something that I think is so important. A lot of people are doing Western medicine and they want to integrate maybe Chinese, but they don't, or Eastern medicine, but they don't really know how it can help them, why it could help them, what they can do. So you are the absolutely perfect person to be here today with your background and just sharing all this with us. So welcome.
Oh, thank you so much for having me. I'm happy to talk to you. You're so fun to talk to.
So you know what? I love hearing the backstory, how you got to combine both Eastern and Western medicine, because you didn't start out, wasn't that you were born in China or anything. So can you, so tell us about your journey and how this came to be.
Okay. Well, I mean, we could go to any place in my past, but the beginning of my desire to be a doctor was when I was 5. When I was 5, my parents had split up and my mom was a single mom and she's working all the time. So I had my great grandmother taking care of me, and I spent a lot of time with her. So she was the person who spent most of her time with me. And one day I was hanging out with her in the evening, and she lived right next door to my mom, or to where we lived. And so I was hanging out with her, and all of a sudden she collapsed on the floor and I couldn't wake her up. And of course, it's very, very scary, right? I'm 5 and I don't know what's happening. So I ran to get my mom and my grandma, who were next door, and they came and they called an ambulance. And I remember her being lifted through, because her door was kind of small. So I remember them having to take her through her window and taking her to the hospital, but couldn't wake her up. And a few days later, my mom came and told me that her heart had stopped beating and that I would never see her again. And my heart stopped beating. I was like, what, but I didn't know what that meant. And I remember like wanting in that moment to do anything to bring her back, that she was my person, right? And wishing that there was something I could do. But I also remember thinking, okay, what can I do? And I started imagining something to make her heart start beating, and wanting a miracle. And I think that's the important thing for me was, well, of course, that day is when around then I decided I wanted to be a doctor so I could fix people. But the important thing was this idea that I could fix somebody, or that a miracle could happen, that they could not necessarily, of course, my wish at age 5 was to bring her back from the dead, but can't do that. But so my whole life has been dedicated to finding solutions. And so that's how I've been, forever. And so fast forward many years, I was in medical school finally after many years. And I was in an ER rotation, and somebody was brought in who had a gunshot wound that was close to his heart. And I got to go with the surgeons to the operating room because they didn't have anybody to hold the retractor. So I got to hold the retractors, which is what, to get into the chest, and we saved his life. And it was so exciting. It was like, oh my God, we saved him from the death's door, right there. And so I was like, okay, I want to be a surgeon because there it is. My whole purpose of living is to save people's lives. Right. So, and so fast forward a few more months, and actually they wanted me to be a surgeon. So I got into a residency and I started surgical residency. And pretty quickly, because my lifelong goal had been to be a doctor, and I hadn't really seen past that. I think, they say when you're like in your late 20s, things start to wake up inside of you, or maybe your mission on earth, or I don't know. But I started to question it, partly because the patients that I was seeing, even the best that we could do, some of them didn't get better. Some of them didn't get alive. Some of them didn't, and then there was this whole idea that there was so much more to living than just being saved from death's door. There was living. And I started just asking that. I asked it for myself, because I hit some crises personally, and I asked it for my patients. And I was like, well, what will keep a person, like what will make a person feel good? And so I hit this point where I became very depressed and was like, okay, what's the meaning of my life? Why am I here? What am I doing becoming a surgeon if it's not saving lives in the way that I want to, And so I took a month off. And during my month off, I got sick and spent like a few days in bed. And I was visiting my mom. So she was wise enough to just leave me alone in the dark room. And the last night of being sick, this is so like epic, right? I had this dream. If you stay in surgery, you will die. I'm like, what? but I was used to being guided by my inner voice, and so when I heard my inner voice, I would follow whatever it said to me, and sometimes it led me the wrong way, but I won't go into that right now. But so I decided, okay, I wasn't happy doing what I was doing anyway, and I needed to find what was right for me, but I didn't really want any other medical specialty. And so I went back after my month off, I went back and resumed my residency, and like, what am I going to do? And somebody gave me a book, and it's called The Web That Has No Weaver. It was about Chinese medicine. And I didn't know anything. I had never even heard of acupuncture or Chinese medicine or anything like that. And I was like, well, okay. And I started reading it. It was beautifully written. Like this is one of the things about Chinese medicine, or the people who've written books that I read, so beautifully written. And I became fascinated about the idea of energy and the idea of healing and the idea that healing could happen in a whole different way. And I had always, as a child, been interested in herbs and natural healing anyway. So that surgery was a big switch for me. And so when I read this book, I was like, I want to learn this. I want to be an acupuncturist. And so I left my residency at the end of my second year, and I went and worked in the ER, and then I went to acupuncture school. And that's shortening the story because there was a lot of guidance in between, but and then every semester that I was in acupuncture school, I would be like, why am I still in school? Like I've been in school already 100 years and I'm still in school for 3 years of acupuncture school. But every semester this happened, I would ask that question and something would happen to somebody in the ER or my own body where that didn't have an explanation in Western medicine. And so I'd go, oh, okay. So, but I could understand it from the perspective of Chinese medicine, so like there was, and it was ongoing, and this is in the 80s. So in the 80s, our functional medicine wasn't advanced. It didn't even exist. I don't think. I don't want to say it didn't, but I didn't know anything about it. And so we didn't have all the advanced labs that you can do now in functional medicine, where you can study things much more deeply. So when a person came in with mysterious symptoms, if there was no answer with the tests that we had available or the best that we could do, I had Chinese medicine as a tool, and I could understand what was happening to them, because it was about energy and learning to understand what was happening in their body with energy. So maybe I should give a little brief explanation of Chinese medicine.
Yeah, why don't we? This story has me captivated, Dr. Shiroko. I can't even get over it because it's just so interesting. I never knew really how you got to what you do. I love what you do, but this is so very interesting. Yeah, so why don't we get to that point now? What it is and what you saw could help, because I don't think a lot of people, some people are doing like Tai Chi, they may be doing some Qigong, but I don't know that people really understand the essence of Chinese medicine and the philosophy and how it is different and how there's a lot that can be offered. So yes, why don't you just go into that? That'd be great.
So I've been doing Chinese medicine now for more than 30 years. So this is how much I'm in love with it, right? So Chinese medicine is based on the idea that you're made up of energy, and energy travels through your body in certain patterns. And when it's out of balance, it's all about balance. When it's out of balance, you develop problems. And energy there's all kinds of factors that regulate what energy is, right? There's the yin and the yang, which is masculine and feminine, daytime, nighttime, like that balance in between those two elements of energy. And then there's whether it comes from outside your body or inside your body. And there's all these factors that affect how your energy moves. So the idea is that it's all about balance. And where is balance in order to help your body feel well? And balance isn't about standing still. Balance is a flow, it's a movement. And so, I've been a member of the American Academy of Medical Acupuncture, which is physicians who do acupuncture, for several years. And one of the things that is, I think, been difficult for the West about Chinese medicine is trying to define it, quote unquote, scientifically, because we talk about the research and what research shows. The research shows a lot of things, like how it helps with bronchitis, how it helps with ulcers, how it helps with hormone balance, which is really huge, or digestion, like all the things you can do with Chinese medicine using acupuncture or Chinese herbal medicine that is different than what Western medicine says. And trying to fit Chinese medicine into that box I think is a mistake. And so I'm the person who's always saying, no, it's not about, connecting it to your nervous system. Of course, your nervous system is a part of it, but it's not about trying to fit it into our understanding of Western anatomy. It's about understanding that energy actually is something that moves inside your body. And that when it's moving, it helps you be healthy. It's that, years ago, I read a study where they were trying to figure out what is life and what determines when you're dead, when your soul leaves your body, if you believe that. And the Russians did some study that showed of a person who was dying, and they measured the energy in the room. And I don't know how they did that, but they measured the energy in the room. And then when that person died, the energy was gone. That energy was gone. So what was that? That's the thing that runs our lives, that runs our bodies. And so that's kind of where I have worked with people, is to help them understand that it's all about finding balance, finding what makes your body work the best.
Oh, I love this. So you know what? Let's take it home, because a lot of people listening, people have all sorts of issues, but there are a lot of people who are going to be listening and are concerned about their bone health. So can we sort of go through how you combine the two? Would that work?
Sure. Yeah.
Okay.
Absolutely.
So someone comes in, let's say they're 60 or 55, and they have, osteoporosis. They're diagnosed with osteoporosis and they haven't really done anything. So we don't know anything about the root causes. Let's just make it very general in terms of the different things that you can use from Chinese medicine. I know you use some different tests that are, I know when you examine someone, you look at things that other people don't. So maybe let's just go through what pieces you would combine from both.
Sure, absolutely. So my initial visit with somebody is an hour and a half long. So when they come in, they tell me their story, and I spend a lot of time listening to their story, like what happened, where did it come from. And I don't just do Chinese medicine and Western medicine, I also do functional medicine. And in functional medicine, I think functional medicine is the perfect mate to Chinese medicine. And functional medicine is based on looking at our bodies. This is a Western medicine style, but looking at our bodies from a perspective of the systems that run them. So instead of looking at your heart or your bones individually or your kidneys individually, because that's my training in Western medicine, is just to look at the organs and say, well, if it's not working, put this on it, right? But in functional medicine, we're looking at the systems, like your hormone system, your which endocrine system, your digestive system, your nervous system, like how all those things work together. And to find, again, it's about finding the tools that will help those systems function at their best. So that's why it's called functional. So I blend those two together. So when somebody comes in, I ask a lot of questions, both from the Chinese medicine perspective and from the functional medicine perspective. And in functional medicine, we're looking at possibly birth trauma. It includes all kinds of things, like what influences the different systems to function the way that they're functioning. So was there something that happened when you were born? Were you breastfed? What kind of foods were you fed? Because the foods and the diet are a vitally important part to figuring out, how to get your body in balance. What kind of traumas did you experience as a child? Like, were you beaten? Were you molested? Like, what kind of other things happened? So I ask all of those kind of questions within that 1.5 hours. And then I do an exam, both Chinese and Western, and based on, so the Chinese medicine is sort of my foundation. So I look at a person from, okay, what organs are out of balance? And I do that in my exam. So I can feel the pulse, I feel the belly, I feel the feet, I feel all kinds of places to see which organs are not functioning well. And then
wait, can you stop for a second? So from one of the skills that a practitioner such as yourself has learned then is to feel the pulse, is to really get major information that can help you diagnose or figure out what's going on from these different tests. That is quite different than Western medicine, where they would never feel your pulse. So continue.
Right. Or feel your belly, really.
Yeah.
Unless it's in pain, right? So I do all those things, and then based on what I find from the Chinese medicine point of view, I choose specific tests from the functional medicine point of view to figure out, like, what else do we need to understand. So for a person with osteoporosis, I might want to know how much are they really losing bone. There are tests, and I'm sure your audience knows this already, so I might be speaking to the choir, but there's a urine test you can do to see how much bone is being lost, rather than just doing an x-ray, because an x-ray is comparing you to a 23-year-old. It's like the standards of bone health are versus, a 50-something, 60-something person versus a 23-year-old set of bones, right? And so it might not be an accurate parameter, 1. And 2, they change very slowly. They take months, years to change. Like the base of your spine changes every 7 years, not every, few months. But the urine test can change every few months. So you can follow, what we're doing working? Is it slowing the bone loss?
I say something else about this. I think that I couldn't agree with you more, because sometimes you don't know. Is it that as a child you had eating disorders and you didn't exercise, so you never had, the DEX? So those tests aren't going to tell you what you just, you have one time, the first time you get this, you have no idea. So I think that gives you so much information. Are you actively losing bone at this moment, and how much? So I think that's such an important test and really helps differentiate.
Yeah, it really does. Yeah. And there's so many factors, right? So again, bone loss, like if you just look at bone loss, then you're not taking into account the whole body, which is again where functional medicine plays this beautiful role. Like, is it something in your digestion? Is it something that has to do with your hormones? Is it something, so your digestive system, your endocrine system, your thyroid versus your adrenals, like there's all these factors. And so in my process, so looking at it from the Chinese medicine point of view, I figure out, okay, which organ is out of balance. So let's say for this woman, her digestive system is out of balance. Then I would do a stool test to see what's going on. I would work with the digestive system to help it function better in order to help bones stop being lost. If it was a hormonal imbalance, I would look at what's called a Dutch test to see, what's going on with the hormones. Why are you losing bone at this point in your life? So, and there's different causes for every person. So that's how I use the Western medicine. And then from the Chinese medicine perspective, I will do acupuncture or self acupressure, depending on where the person is, and I have ways of working with people remotely to understand what's happening to them from the Chinese perspective and to understand how to help them from the Chinese perspective. So I just bring the two together, and I've been doing both of them since I was, left my residency, basically, like I went to work in the ER basically at the same time I went to acupuncture school. So the two of them got married, Chinese Western medicine got married within me in my experience and training, so it's been this journey of understanding both ways of doing things and bringing them together, which is really how you do things in China. So
oh, I love this. So let's talk about specifically bones for a minute, because there are patterns that you see and that there are patterns that exist. So why don't you tell us about what energy, what do you see, just tell us about a little bit about the organs and how that correlates with osteoporosis and bone health, and maybe some things that everybody can do to help that specific energy.
Sure. So in Chinese medicine, the kidneys rule your low back, your knees, your bones, your overall sense of having energy, big transitions in life, the emotion of fear, your physical brain. So the literally your physical brain, your hearing, and your power of will. So that like your get up and go kind of power of will. And every organ in Chinese medicine has physical functions, emotional and spiritual functions, different from its buddies, right? So and the kidneys, basically they rule the strength of your bones. So and overall sense of having energy and big transitions in life, basically that's menopause, right? So your overall sense of having energy is connected to everything, really. But then big transitions in life are puberty and menopause. And so like those are the big transitions. But then there's also divorce and moving across country, like those are also big transitions in life, and the kidneys rule that. So taking care of your kidneys is kind of the main focus if you're going to deal with osteoporosis, but the kidneys also help support all the other organs. So the kidneys are also the source of what we call your essence, the energy that you're born with. So you're born with a certain amount of energy, and how you spend your energy in your life is where your life goes, right? So where health goes. So, and there's all kinds of rules of how to take care of your life. So not overworking, like everything in moderation is what they say. So you eat, you live in balance with your environment, you live in balance with your things that you have to do. You don't work too hard. You don't have too much sex, actually. One of the things like too much sex or not enough sex, or like all of the things that we do in our lives, like to find balance in all of our activities, maintains our essence, which is what maintains our energy. So when you look at it, like we get a bucket of energy that we're born with, and that's where everybody's different, right? So that's what we would call our genetics. So that's where genetics would come into play. But genetics isn't everything, because everything that you do either fills the bucket or empties the bucket. So how you exercise, how you Over-exercise is harmful. And now with our science, we're learning, like especially as women are approaching middle age, perimenopause, we're finding that over-exercise is really harmful. Doing the wrong kind of exercise is really harmful because you can cause your bones to be weaker. So finding the right exercise, finding the right way to tune into what your body needs at different times of life. I remember when I was in my 40s, I had a little car accident. I thought it was a little car accident. My car got spun around and it was a little car. And after I used to do kickboxing, and I was like, and it was like my way to release stress, right? Well, after that accident, I couldn't do kickboxing anymore because it would throw my back out. And I was in my, like, I think it was 43 or 44, something like that. So, but we all have those experiences. We all have those things that change. So especially some of my clients who are really athletic, because I love to go to the gym and I used to love to work out really hard, but as I've changed over the years, I've found that certain kinds of workouts don't work anymore. And learning how to tune into what those things are is a part of finding the right balance.
Can I just say something? This is such a very, very good point that you bring out, because with osteoporosis, really what's been shown to increase bone density is high intensity type of workouts. So we certainly you need to balance that, in terms of, it's not a lot of repetitions though, but people need to balance that so that they're not depleting any of their kidney energy or their essence. And I think that's such a big point. I know that's in your book a lot, where you listen to your body and balance, but I don't think most, and I know myself included, in terms of getting out of balance or working too much, it's so easy to fall into that. But when you realize that this is what's needed for healing, it just brings it all back. And so thank you for reminding us this important point.
Yeah, exactly. Yeah.
Okay, so let's see, where were we then? We were, so we were
about the kidneys. Yeah. So the kidneys are sort of the most important element in Chinese medicine related to bones. But what feeds your kidneys, so like taking in food, transforming that food into energy and bringing that food to the kidneys in order to support. So digestive system is important. Our breath is important. Like when we breathe in, that circulates the oxygen, but it also circulates the fluids that go to the kidneys that help the kidneys do their job. So it's again all about balance and which organs are out of place. And so it's finding that right balance for your body that will help it maintain healthy bones. But it's a big picture thing. And so I always take it from the big picture to okay, which picture do we focus on? And I still, like, one of the ways I use energy work or acupuncture is to bring all those things together. So it's about all the systems communicating with each other in order for them to work together.
Oh, love this. And so if you were to share, well, let's do a couple things. If there was one practice that everybody listening could easily do, is there anything, just like one easy thing people could do for their kidneys?
Oh, sure. It's my favorite.
Okay.
Let me stand up, and I don't know what I'm wearing.
You know what I'll do? No, you're good. I'm gonna just change the view for a second so everybody can even see you better. Hang on one second. Okay.
So right here is where your kidneys are. And this is a simple little Qigong exercise where you go like this. You just massage your kidneys. Like that.
And in that direction, does that matter, Dr. Shiroko?
Yeah, it matters a little bit.
Okay.
It doesn't feel right to do it this way. So you can tell by how you feel what's right to do. Again, this is about listening, but just massaging right here is and then you could put your intention there to like love your kidneys and to love your energy and to love your bones. There's many ways of making something better. You could do this with any kind of exercise that you do, with when you eat. to bring all of your focus, all of your attention to that action makes it more potent.
Wow.
Makes it more effective. So
I love that. And it feels so good. And is there an amount of repetitions you'd recommend? How long you do this for?
Well, in Qigong, it's always the odd numbers. And even like in Chinese medicine and acupuncture, there's an moxa thing that we do, and you do it with odd numbers of, anyway, they're like odd numbers, not even numbers. So it's 49, 7 times 7.
Okay. So what if,
wow. Yeah, I have one lady right now who's in her 80s, and I was teaching her this, and she's like, it's hard for me to do because I'm out of shape. And I said, well, just do 7. And she said 7, and then later in the day, do another 7. And eventually you'll get to being able to do 49. So you don't have to do 49 if it's hard for you to do, or if your body feels tired, or it's hard for your arms to go back here. Even if you even if you can't get here because your arms might not want to go there, you could just kind of, how do I say it? You could put your arms somewhere else that's easier and still be on the path, right? Or you could even imagine, like, if you can't put them back here, you could even put your arms here and kind of massage here and imagine it going all the way back here.
Oh, great.
Just with your intention, because your intention can bring just as much healing and energy as your action, you know.
Oh,
so
I love that. And what a great thing to take a break, stand up. We're so much with our computers, so much. So what a great thing to add to your break, stand up. How many times, if someone can do it, what's your recommendation in terms of times a day?
Oh, 1 or 2.
Okay. Great. Oh, good. So I actually, before we go on, there was 2 things you said that I just want to draw attention to, because your book is amazing. I completely resonate with the message of your book, healing when it seems impossible, the 7 keys to defying the odds. It's just so great. But the very first chapter is the healing power of love. And so now you're saying, take that love, and I teach happiness, so I'm completely in alignment with this principle. But now take that love into the massage and into everything you're doing. Do you want to just share a little bit about? We could talk an hour on love, but just a quick thing about love.
10 hours on love. Well, in my book, the reason that love is the first key to healing is because so many people, when your body starts acting up and when you start not feeling good, you feel betrayed. You get angry at your body. And so I bring love into the equation right away, because you don't want to be mad at your body. Your body's your very best friend. There is nobody else who's a better friend than your body. Nobody else. And your spirit lives in your body, right? And so if you hate your body and you're angry at it, you're always directing negativity towards yourself. It's not helping. It's not helping you get well. And being angry and betrayed by your body makes you not want to do good things for it. But what if you treated it like it was your best friend? So the whole point of love being the first key is to recognize the power of love. And the love is the most healing force in the universe. Like it's what brings healing. And I tell stories in the book about a client that had a serious car accident and was in the ICU, and somebody else had a similarly serious car accident in the same ICU, and her family was around her, surrounded her, and sat next to her bed every day. And the other person didn't have that. And this person that had all that love directed at her and all that caring, and she got better, and this other person didn't. So just the power of love. And there's been studies actually about the power of prayer, which is another layer of directing love, even if you're far, far away. The energy of love is incredibly healing, and there's science behind it. There's the hormone oxytocin that we produce when we have love. And the oxytocin actually helps your body have better energy. It helps your body be healthier. So, I mean, I could go on and on and on. So I don't know how much you want me to
Yeah,
go
no,
into.
no, no. I think that's so important. I mean, that's what I see all these years, 35 years working as a physical therapist. That's what I've seen as well. When you don't have that self-love, it's very hard to get better. It's such an important piece. And I don't think people realize that because, we're so nice to the whole world, but we're not very often very not nice to ourselves. So I think that's a very important concept. And I love the way that you have it as the first chapter. So that was really terrific. Okay, so that was one piece. The second, yeah.
I want to say something about love because it is self-love,
Mm-hmm.
but sometimes we have a hard time directing love towards ourselves for whatever reason. And if you give love purposely to something or someone else, it comes back to you. So if you have a hard time loving yourself, or you have a hard time going, massaging your back and loving yourself when you're doing it, love someone else. Do something nice for someone else. Anything nice or loving that you do for someone else is 100% more coming back to you, makes you feel good. And I know you all know this, like moms and people who've taken care of others their whole lives, that by giving to others, you're actually giving to yourself.
So beautifully said and so true. And there's one other thing before we move on that you did say that I thought was important. And I'm trying to think how you said it, but it was just about focusing. It sort of tied in with more having a single focus. I don't remember exactly what you said, but I remember thinking that that's an important concept also that we should share. Do you want to just, because that's in your book as well. And I think that's something in our world today we don't do. We're thinking a million things. Our mind is everywhere. And so.
Yeah, I am a person who loves to multitask because I think I have too much to do. And so I'm always doing 500 things at once, thinking that that's the best way to go. But what I have learned sort of the hard way is it's not multitasking, it's one at a time tasking. So you focus on one thing, like I'm focused on you and talking with you right now, even though there's a million other things going on out here. And if I was trying to pay attention to all of those things, I wouldn't be able to answer your questions properly, right? Just that. Um,
Yeah.
and so single focus is a really great healing tool because if you just focus on one element of whatever's going on with you at a time, then you can really listen, really pay attention, really tune in to that element. It's a great tool for anybody who's experiencing anxiety, actually, because when you're experiencing anxiety, there's a lot of different symptoms. There's heart racing, sweating, feeling like, I got to move, like all of that stuff. And this was taught to me when I did the disaster recovery thing. A woman was saying, well, just focus on one symptom. So let's say it's your heart racing. So you just put your hand on your heart and you feel your heart racing and you just breathe and you feel that one thing, a single focus. Say, or let's say you're like feeling that emotion of so you hug yourself and you feel that one thing, that emotion, that fear or whatever. And when you focus on that one thing, it will start to shift within 90 seconds. Like it shifts pretty quickly. So it doesn't take a lot of time, even if you think you're really busy.
Yeah, I mean, for me, I was the same as you, doing a million things at once. I'd be eating and have the television on and have a book I'm reading and have this. And that was just no way to operate at all. And I learned that after taking this meditation program, I was like, oh my goodness, what am I doing? And it leads to overwhelm. It really does. And it makes such a difference. And now if I ever try to do that, something happens, like someone's looking out for me and everything goes haywire. And you're just like, yes, you know that. So anyway, so one more thing though, before we end, because I thought this was important. We talked about that good practice you could do for the kidney energy, but there's also some foods. Could you briefly tell us maybe a few things we could add into our diets to help activate the kidney energy?
Sure. So again, every organ has different colors, different times of year, different flavors, different like emotions, like I talked about fear for kidneys. Kidney is actually black, and the element of kidney, of course, is water. And so, staying hydrated, drinking water, eating foods that are black, which is an interesting idea, helps support the kidney. So one of the best foods is not exactly black, but it's these little beans called aduki beans. They look like little kidney beans, but they're tiny and they cook really fast, so they're easy to do. But they're really good for your kidney energy.
Great.
So that's black radish, black sesame seeds. I can't think of, salt is the flavor that the kidney likes. And so one of the questions that I ask people is, what flavor do you crave? So a lot of people crave salt. And when you crave salt, it may be a sign that your kidneys are out of balance. And this is another important thing, really, to like Western medicine tests. Like, imagine this is the spectrum of feeling crummy, the whole screen here. And this is where the tests that we do in Western medicine show up. But you may feel crummy here, so you may be craving salt over here. If you're craving salt, that's already a sign that your kidneys aren't happy. Or if your low back hurts a little bit, that might be a sign that your kidneys aren't happy. Or you have fatigue, like these are all things that may not show up in the tests because the tests are over here. And even the amazing functional medicine tests that I do may only come to here. So we have this whole range of progression of something that you could be taking care of yourself. And that's the beauty of Chinese medicine too, is this idea of listening, and my book, all the things that I say, it's like taking care of yourself in a way that's listening here rather than waiting till you get here.
Which is so great. So a couple things. So I want everyone to know what's possible. So first of all, there's the book. We'll have the link to that. But you have a great thing as well. You have a workbook. So when you order that and I'll have your site on, is that the best place for people to order it?
Yeah.
And then they just send in like something and they get the workbook as well. Do I have that right?
Yeah.
Okay. So that's a huge resource, huge. And I think the book is, I just, when I'm reading it, it just, so many of the principles just resonate so much with what I found for my practice makes such a big difference. They're just so profound, like each thing. So it's really a wonderful book. You've done a great job. And so that's number one. Number two is that people can contact you because you also work virtually. So I'll put the link. Is the best place what's the best way people can contact you if they're interested in working with you?
You can book a free call and I'll give you the link for that. And if you book a free call, and you can talk to me about whatever for half an hour
and see if it's a good fit for you. Oh, that's great. And so the nice thing is, though, even though they may not see you, there's so many other tools besides the acupuncture that you can do virtually, which is really, really wonderful. Okay. And then the third thing I want to tell everyone about is that March 28th at 3:00 p.m. Eastern Standard Time, you are doing a program with me where you're going to really demonstrate the practices. So it's going to be an hour long, and you're really going to show us some things that we can do, like you showed us that one, but really delve into some really great, easy practices we can all put into our life to help with our bones and help with kidney energy. So, and we're not charging very much for that at all. So I'll have that information below. Anyone in my bones class it's part of it. And so that will be really, really exciting. So I'll have that as well. So is there anything? Cool. Yeah. I'm really excited because what I find is the more things we have in our arsenal that are easy, that we can put into our life, and maybe we haven't thought of, oh gosh, that's not part of my regimen, kidney energy, but you can incorporate it in easy. Like, how hard is that to do what you showed us? And just, and just add these things easily to your life, not overwhelm. And that really, really make a big difference. And anyway, I can't thank you enough. Is there any last minute things before? We could talk 10 hours because this is so great. And I just truly, truly love the work that you do. And I think this is a piece that's missing. And I know you've helped so many people in this combination. So any last minute things you want to say?
Well, I'm just drawn to the flowers that you have back there. and I have been doing a practice myself recently Like when we were talking about love and how sometimes it's hard to love yourself, but how hard is it to love a flower? And everybody has access to flowers. They're everywhere, right? And I love flowers. I don't know. I did these paintings that are behind me.
You made, wait. You painted them?
Yeah, I
With the
painted them.
sunflowers? Oh, and I have sunflowers too.
Yeah,
Those
they
are
were my
beautiful. Wow,
yeah,
those are
they were my
gorgeous.
COVID therapy, actually.
Wow, that's
but,
beautiful.
but those there are poppies, and then these are sunflowers. And the cool thing about flowers is how different they are. Like looking at the flowers that you have behind you, there are so many different flowers. And so what I've been doing lately, just I like creating little short exercises that help me feel good, so that because I'm a busy person, and so I want to do something that'll make me feel good in an instant. So I always have flowers in my house, and I'll take a flower and I'll look at it and I'll just appreciate its beauty. Because like, have you ever seen a flower that's not beautiful? There's some
Ah,
flowers that don't smell good, but have you ever seen a flower that's not beautiful? It's like there's so much beauty. And to me, appreciating a flower is a way to appreciate yourself. So like to look at that beautiful flower and to feel like, oh my God, there's, and you could take your favorite flower first, but then take another flower like a carnation or a rose or a sunflower, or there's millions of different flowers and they're all beautiful. And it's a great way to think about yourself and your friends. And like when you appreciate one friend for her beauty and another friend, you don't appreciate her beauty as much, but think about it. She's just as beautiful.
I can't even tell you how much I love that. It's funny
Yeah.
because someone had said to me, you're a medical person, you need to have like a spine there. So I put my spine there for 10 minutes. I think I recorded one video with it. And I'm like, nope, I need my flowers because I love arranging them. I mean, I have so much fun because I always buy new flowers and it gives me such pleasure. But what a great practice, especially if you're not really feeling, any way will elevate you. Wow, what a great way to end. Well, thank you so
Yeah.
much. I'll have all the links in the show notes, and I'm very excited for it's coming up. And for people who are listening and this is over, you'll be able to access the replay. So don't worry that this is after the date. You'll still have access to the replay and all the practices. So thank you so much, Dr. Shiroko. It's been such a pleasure.
Thank you. It's been a pleasure talking to you. Thanks for having me.
I really enjoyed my interview with Dr. Shiroko, and I hope you did as well. And now have a better understanding how we can merge concepts and principles from Chinese medicine and Western medicine to help our bones, overall health, even our happiness. All the links Dr. Shiroko talked about will be in the show notes. And remember, if you can come, she's going to be doing a great program on March 28th at 3:00 p.m. Eastern Time, where she's going to really demonstrate 8 practices that can from Chinese medicine that can help our bone health. And if you're listening to this afterwards, you'll be able to access the replay. So thank you so much for tuning in, and I look forward to seeing you on the next episode.